Welcome back to the Nursing Moms, and in this video here today I'm going to share with you the danger signs of pregnancy, the warning signs and the symptoms of unhealthy pregnancy. When exactly you are supposed to go and see a doctor about your pregnancy. Stay tuned to the end and please subscribe if you've not done so. Persistent and severe headache. Actually, during pregnancy, at times some women experience mild to moderate headache, but again, this kind of headache goes away after interventions like getting enough rest, rehydration, or even taking analgesic. But when you have that persistent and the headache is severe, and again, it can be accompanied by blurred vision. You are not seeing things clearly. Honey, this is not a good sign. You need to see your doctor because this can be an indication of increased or elevated blood pressure, vaginal bleeding. In some women, spotting is very common in early pregnancy, and again, such pregnancies do carry successfully to term without any other complication. But again, once you've started seeing blood, that heavy bleeding during pregnancy can be a very unhealthy sign. It can be an indication of miscarriage, ectopic pregnancy, or even placenta abruption. Once you've seen fresh blood, kindly go and visit your doctor. It's an emergency case. You need to go to the hospital as soon as you can to save the life of your baby. Two is abnormal fundal height. Your growing belly will correspond with the growing fetus inside throughout the pregnancy period. And again, you realize once you go to the hospital for your antenatal care visits, the nurse will be taking a tape measure to measure your fundal height. This is very normal and it is a healthy practice just to know how far your fundal height is. If your fundal height is not corresponding with the gestational age of the baby, then it can be an indication. If your belly is not growing, it can be an indication that there is a restricted growth inside, that is intrauterine growth retardation of the baby, or even a reduced amniotic fluid. Yeah, all this can show why your belly is not growing. So this can be detected at the antenatal, and an ultrasound can be done to detect why your belly is not growing. Severe abdominal pains or cramping. In pregnancy, due to the growing uterus, actually there are several changes in your bones and the ligaments just in order to accommodate the growing uterus. This can always lead to mild and moderate pains, but again, if the pain is so severe, and again it's accompanied by cramping, this can be a sign that there is something that is not okay and you need to go and see a doctor. You should not have a very severe abdominal pains or cramping. Cramping is a sign that maybe the uterus is contracting, and any contraction can lead to expulsion of the product of conception. Persistent and severe vomiting. Actually, during pregnancy, vomiting is very common. But again, if you realize you are not retaining anything, you are vomiting almost everything, this can lead to electrolyte imbalance and dehydration. Actually, if you realize you cannot retain anything and you have that prolonged vomiting, you need to go to the hospital for further management. Reduced or no fetal movement. Actually, if you know how to track your baby movements, that is the doing the fetal kick count, and you've done so and you realize that the baby is not moving okay, there is reduced or no fetal movement at all. This is a very worrying sign because it shows that the baby is not receiving optimum levels of oxygen and you need to go and see a doctor as soon as you can. Swelling of the legs, the face, or even the hands. Puffiness is not a good sign during pregnancy. This can be an indication that the pressure is elevated. So you need to go and see a doctor if you realize you have those swollen feet, swollen hands, or even puffiness on your face. Your face is swollen and not as usual. Fevers. Having fevers or running high temperatures is a sign of an infection. It can be either bacterial or even viral infection. And again, any infection is a threat to pregnancy because it can lead to either premature labor. If you're running fevers, kindly do not take the over-counter drugs. The best thing to do is to go to the hospital and get tested and treated to prevent any other further complications. Another serious and very bad sign to be on the lookout for is having convulsions or even fits. Convulsions or fits is an indication that your blood pressure is extremely elevated, and it's an indication of an impending eclampsia emergency. Consider this as a medical emergency. Lastly, if you experience that you are too weak to get out of bed, recurrent infections, then you need to see your doctor, because this too is not a healthy sign during pregnancy. You are ever sick and always very, very weak to even do your normal activities or even get out of bed. Kindly visit your doctor, discuss with her, him, and they'll see the investigations to do and the way forward to help you in your pregnancy. Knowing these signs and symptoms is very important because they can help you in early diagnosis, management, and even prevention of further complications. So it's important to know the healthy signs and the unhealthy signs in pregnancy. Thank you for watching to the end. Let's meet in my next video. Bye.